Polyydramnios Transient Antenatal Bartters Syndrome and MAGED2 Mutations. Definition: Antenatal Bartters Syndrome is an inherited disorder characterized by renal salt wasting and fetal polyuria, resulting in severe hydramnios and premature delivery. Treatment: you will need to, in the medicine, 1. Water restriction, low sodium regimen, and the administration of diuretics are not very effective measures. 2. The administration of indomethacin at doses of 1.5 to 3 milligrams per kilogram of weight per day is an indicated measure with variable results. 3. In chronic polyhydramnios, preterm labor prophylaxis will be done. 4. In acute patients, it is advisable to reduce intra-abdominal tension by means of transabdominal puncture. 5. The amount of fluid to be extracted will be conditioned by the total volume of existing amniotic fluid. Application in medicine. Although virtually all forms of Antenatal Bartters syndrome persist, some cases are transient with spontaneous resolution of symptoms shortly after birth. Konhoff explains that his interest in transient antenatal Bartters syndrome developed after encountering a family in week 3 pregnancies with male offspring were complicated by early onset polyhydramnios and prematurity. One fetus died, whereas the two living infants had a Bartter-like syndrome with substantial salt wasting and polyuria that resolved within a few weeks. Pros and cons. Polyhydramnios can occur if the fetus doesn't swallow and absorbs amniotic fluid in normal amounts. This can happen if the baby has certain health problems, including gastrointestinal disorders such as duodenal atresia, esophageal atresia, gastroenteritis, and diaphragmatic hernia. Brain and nervous system problems such as anencephaly and myotonic dystrophy. Achondroplasia, Beck-Wiedemann syndrome. Ultrasound obstetric risk of alteration of fetal maternal diet. Domain age, sexuality. Class 3, reproduction. Risks of alteration of maternal fetal symbolic diet as a result of mobility or condition related to pregnancy. It is a condition that occurs when too much amniotic fluid builds up during pregnancy. It is also known as amniotic fluid disorder or hydromania. Issue applied in Ecuador. The following case is a 17-year-old female patient with a gyneco-obstetric history of menarche at 11 years, irregular menstrual cycles once a month for 5 days, IVSA at 15 years, CS number 3, disease of sexual transmission, no. Packs hasn't been carried out. Dicks 1 current. Abortions 0. Having as the day of the last menstruation the February 20th, 2016. Reliable according to the patient giving a pregnancy of 33 weeks. Patient comes with her mother to the emergency service of the Ambato Provincial Teaching Hospital, reporting abdominal pain of more or less 2 hours, tight contraction located in the hypogastrium and radiating to the lumbar region, of moderate intensity, plus removal of mucus plug and decreased fetal movement. It was assisted by an obstetrician, finding the abdomen, pregnant uterus, single egg fetus, left back mobile, with a FCF of 136 to 140, decreased fetal movement, and sporadic uterine activity, lower lines edema plus genital region. There is no evidence of transvaginal fluid loss to touch. To 4 centimeters dilatation and 70% effacement with integral membranes of high-necked pelvis, with results of steric echosonography plus PVF plus Doppler fluorometry of pregnancy of 32.4 weeks, not consistent with LMP, amniotic fluid index of 27.2, posterior fundic placenta 3.9 centimeter thick, with signs of maturity grade 3. Conclusion. This recent information about the effect of the mutation of the MAGED2 gene is important to consider, so doctors can give a good and complete diagnosis and also give the best care during the pregnancy. As it's a gene mutation, there isn't a treatment for the MAGED2, but what can be treated is the Polyydramnios and the effect produced in the Bartters syndrome. Also, these diseases aren't normally dangerous or lethal.